Afternoon. I hope everyone had a good weekend. I want to first applaud people across Ontario, especially in Toronto, Peel, York, and Ottawa, for coming up with creative and fun activities so that our kids were able to enjoy Halloween safely on Saturday. I know it was a different way to celebrate this year, but your actions will go a long way in our efforts to reduce the transmission of COVID-19. For today's update, I will be providing a brief overview and provide some comments on our recent numbers. Over the weekend, Ontario reported 1,015 new cases on Saturday, 977 new cases on Sunday, and today the number has decreased slightly. We're reporting 948 new cases. The 7-day average now stands at 919 cases, up from 878 a week ago. Most of the cases, 77% of them, reported over the last few days continue to be concentrated in the health units that are in a modified stage 2, Toronto, Peel, York, and Ottawa. In terms of testing, system-wide yesterday there were almost 28,000 tests completed with a positivity rate of 4%. That is the highest positivity rate we've seen in quite some time. While the daily case counts remain high, they are not increasing at the rate that was initially predicted by our modeling. And this is good news. That said, the numbers are still far higher than we would like them to be. We continue to ask all Ontarians, whether you reside in one of the regions currently in a modified stage 2 or not, to please continue adhering to the basic public health measures that we know to be effective. Please continue to stay home if you're feeling ill. Keep your distance from people who are not in your household. Wear a mask and wash your hands frequently. By adhering to these measures and actions, we can hopefully prevent the numbers from increasing any further. Thank you. I'll turn it over now for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question comes from Ashley Logasic at News Talk 1010. Please go ahead.
Hi, Dr. Yaffe. Thank you for taking my question.
Hi.
In the time since Toronto, Peel, and Ottawa moved back to a modified stage 2, what have we learned about making restaurants and gyms safer? And can you give us an idea of what changes will be recommended to Cabinet to safely reopen these businesses?
Well, actually, our public health measures table is working right now on how to address the situation in terms of trying to open these places but make them safer. So we'll have to see what they come up with. I think the bottom line, as always, is trying to, when you're dealing with indoor spaces, you want less people and you want them to keep further apart and wearing a mask and hopefully not breathing heavily or shouting or singing. So those are the basic measures we want in place in any indoor setting to prevent transmission. So they're working on that now in terms of the specifics, though.
Okay, thank you. And I'm wondering if you have any statistics on how out-of-province travel, people coming to Ontario, has impacted the province's COVID-19 numbers. If you don't have those hard numbers, are you able to kind of explain anecdotally if this has come up as an issue?
Well, I don't think travel has come up as a major issue recently. Certainly at the beginning of the pandemic, it was the major risk factor, as you know. Now it's more close contact, household contacts, people in congregate settings. So I'm just looking at the risk factors. Travel is a very, very minor piece of the whole picture, but of course we always do ask about travel as one of the risk factors. And we still continue to have border crossings from the U.S. to Canada are very much limited to essential workers. So I think that would be a bigger concern if that were to open up.
Next question.
Next question comes from Randy Rath at CHCH TV. Please go ahead.
Hi, Dr. Yaffe.
Hi.
I'm wondering about something that you said on Friday. There's been a lot of outrage about restaurants and bars, gyms being shut down when the numbers presented in the last week showed that the transmission was only 3% from them. But you said on Friday that at the time you shut them down, the transmission from bars and restaurants and gyms was 30 to 40%, and that the 3% number is skewed because it includes time when those establishments were in the modified stage 2. So is this outrage based on a false premise?
Well, to clarify, the figures that I quoted, around 30 to 40% of outbreaks being in restaurants, bars, and gyms, particularly in Toronto and Ottawa, before the modified stage 2 was implemented, was 30 to 40% of outbreaks in community settings. So it didn't take into account congregate settings like long-term care homes, schools, and retirement homes. So looking at community, and that's where the modified stage 2 is to address community transmission. And so that is the number that we were looking at very carefully. And that percentage has gone down quite a bit, obviously, with the implementation of modified stage 2.
Follow up?
So you're still confident that you were correct in moving these areas to a modified stage 2 when you did it?
Right. I believe the government was correct in doing that, yes.
Next question.
Next question comes from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Dr. Yaffe.
Hi.
Can you just clarify what the public health measures table is recommending to Cabinet? Are you recommending some sort of tiered system that municipalities and cities will follow? And can you expand on maybe the clearer criteria that will be present in that and why?
Well, they're actually doing the work as we speak and consulting with, I know we've consulted with the local medical officers of health in the 4 health units that are on modified stage 2, and working with the public health measures table, and then of course with the Minister of Health and the government. And so I cannot talk about the specifics. In fact, they're still being discussed.
Follow up?
And so are we to assume that the province will lift or at least partially lift some restrictions for Toronto, Peel, and Ottawa by this weekend? Is it inevitable that they will no longer be in the same stage that they're at right now?
I don't think anything is inevitable. I would say, though, that the number of cases in Ottawa is going down, which is a very hopeful sign for Ottawa. The numbers are still going up in the other 3. And so I think we'll be looking at different strategies and stages, hopefully.
Next question.
Next question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Good afternoon, Doctor.
Hi.
Could you tell me what was the day or approximate date that you and your colleagues showed the government the data that you showed last week, showing specifically that it was 3 outbreaks in Ottawa tied to restaurants, bars, or clubs, 3 outbreaks in Peel tied to restaurant, bars, or clubs? When did you show them that information?
I can't really speak to the details of when they were shown that information because I personally wouldn't have been part of that meeting. But it was obviously before the implementation of modified stage 2. I do want to say, though, that I know everybody's very focused on outbreaks. And outbreaks are obviously very important. But there are individual cases as well. And looking at where they acquired the infection, that is also very important.
When you made the comments that Randy Rath had asked about last week, I asked your office for clarification, and they said that the way you arrived at the 30 to 40% was to not include long-term care homes, retirement homes, schools, daycares, or hospitals. Now, you say I shouldn't be focusing on outbreaks, but all your data is on outbreaks, so we have to go with the data you give us. Is it fair to present to the government and say, about 40% of outbreaks come from these locations, but not tell them that that's after we've taken out the big spreaders of long-term care homes, retirement homes, schools, daycares, and hospitals. I mean, it's a false premise and a false statistic that you put out in the public last week.
Well, what I put out was the percentage of outbreaks that were in the community, not in congregate settings. So that's not to say, of course, we have had outbreaks in long-term care and other facilities, but there are different measures happening for those. Those are different than outbreaks in the community. So we are looking specifically at community transmission.
Next question, and this will be the last question.
Last question comes from David Haynes at Queen's Park Briefing. Please go ahead.
Hi there, Dr. Yaffe.
Hi.
So the province has made this posting for a job for Ontario Health for a medical officer of health. I was wondering whether the government has consulted on how your office will work with that office, how the two offices will correspond with one another and work in tandem, and how they can, how they will avoid, any kind of turf wars and so on.
Well, that's interesting. When I saw the posting, I actually spoke to Matt Anderson, who's the CEO of Ontario Health, and said the title is very similar to the Chief Medical Officer of Health title and can be very confusing. And he agreed and said that he would probably be changing the title once he gets through the interviews and so on. I think that's the first thing. But this position, as I understand it, is very clinically focused and consulting to the CEO of Ontario Health, which I think is quite appropriate. It's a very clinical focus for hospitals and treatment of people who are ill. Public health is more focused on keeping people well. At the population level, we will definitely have to work very closely with this person, as we do closely work now with Matt Anderson himself. They'll be a very important stakeholder for public health in Ontario, but they will not be doing public health. They'll be doing clinical consultation and advice.
Follow-up, and this is the last question.
The contract for the Chief Medical Officer of Health is set to expire in the coming months. Has there been any kind of succession planning for what will happen there?
Yes, the Chief Medical Officer of Health is appointed by Council, and the order in Council will be expiring early in the new year, but there are obviously discussions happening around how to ensure continuity in that position.
Thanks, everyone.